We have been discussing healthcare in Washington for the past 8-9 months rather vigorously. 4 years ago, I started working on a bill with my colleagues in the Senate, and we introduced a bill 2 years ago and modified it this year. It was introduced before the House bill, it was introduced before the Senate bill, it was introduced before the bill that we have on the floor at this time, and it's called the Patient's Choice Act. And we've heard several times that the Republicans just want to stop this. As a practicing physician, I fully recognize the need to significantly reform healthcare. There is no question. I recognize, and in that bill is guaranteed issue. No pre-existing conditions are allowed in the exchanges under our bill. But I also recognize that as we fix healthcare, some of the things that we cannot do is make our fiscal situation worse and also our inefficiencies worse. And earlier today, I submitted for the record research put out and published in October of 2009, which is a white paper on the waste in our healthcare. And this is Robert Kelly, Vice President, Healthcare Analytics at Thomson Reuters. Highly esteemed, reputable firm that says that every year between $600 and $850 billion of money is wasted in healthcare. It's wasted. It doesn't help anybody get well, and it doesn't prevent anybody from getting sick. And when you look at the breakdown of where that comes from, it's rather apparent that the largest component of it is unwarranted use. And they break that. And what is that? That's me doing, as a physician, I'm a practicing physician, delivered thousands of babies, cared for thousands of grandmoms, granddads, kids, set bones, done operations, old-time, broad-based practice. But what is this unwarranted use? 40% of $700 billion is $280 billion a year. Now, $280 billion a year. They're saying a total of $700 billion. $700 billion times 10 years, in my math, at least from Oklahoma, is $7 trillion. We haven't begun to touch, in any of these other bills, this unwarranted use, the fraud and abuse, 19%. All right? 19% comes to $175 billion a year in fraud. Most of it's not in the private sector. It's in Medicare and Medicaid. That's where most of the fraud is. We haven't begun to attach that. We haven't attacked it. There's minimal, $2 billion over 10 years of direct fraud elimination in the bill that we have on the floor. Administrative system inefficiencies. That's the bureaucratic paperwork that both the hospitals and the doctors spend money on to make sure they maintain compliance with the regulation of medicine. 17%. 17% comes to somewhere between $100 and $150 billion a year. That doesn't help one patient get well. It doesn't prevent one patient from getting sick. In this unwarranted use happens to be the very thing that none of the bills attack except our bill, which is the defensive medicine costs in this country. Defensive medicine costs. Now, why would it be important to fix that? Because it's close to $200 billion a year. $200 billion of tests that are ordered on patients, on procedures that are done on patients that they don't need because the doctor needs to do it to prevent themselves being exposed to unnecessary litigation. $200 billion a year. That's $2 trillion over 10 years. And yet we don't address it, not one iota, in the bill that we have on the floor. Available care, avoidable care. Those are complications. Those are things that we cause. They're iatrogenic. They're induced complications. We're not going to be able to do much of that. We could fix this, lack of care coordination with accountable care organizations, by incentivizing outcomes by grouping and payment for how we pay. But we haven't done any of that. So here's Thomson Reuters that's showing if we really want to drive down costs in our healthcare system, what do we have to do? We have to attack where the waste is. There's nary a gnat's rear end of reduction in these things in the bill that's before us. The other thing that I introduced earlier today was a report by the Congressional Research Service, which was issued December 1st this year, last week. And what did they say? The question that was asked them, what percentage of health care is run or funded by the federal government today, or the governments today? And the number came back. I've been quoting 61% on my back of the envelope calculation. The number came back as affirmed by the Congressional Research that 60% of all health care in America is funded through or by your tax dollars running through a government organization. And the question that has to be asked is, how well are we doing? Could there be any coordination or connection to the fact that the government is now running 60% of the health care, and health care inflation's twice what all the rest of the inflation is? Could there be any connection between the inefficiencies that are in health care and the fact that we have bureaucracies that have themselves in between patients and their providers? I think the answer to that is an astounding yes. You know, I visited with a cardiovascular surgeon because I've made this statement on the floor and people have disputed it. Find me a doctor who has trained in the last 30 years in this country, who spent part of his training at a VA medical center, and ask him the following, or her, the following question. If you or your family were sick and you had the choice of where you trained at a VA hospital or any other hospital you trained, would you go to the VA hospital or would you go to one of the private hospitals where you train? 100% will say no. Now, our VA system has markedly improved. I will readily admit, in certain areas, they're better than anybody else, especially prosthetics, especially post-traumatic syndrome, stress disorder. They're better. But on the vast majority of the issues, they're not. They're run by the government. Look at Indian Health Service. We have a profound legal treaty obligation to provide health care to Native Americans in this country. And yet, Indian health care in this country is abysmal. That's a government-run program. Then look at Medicaid, which we're going to put millions of people in. And what happens? In Medicaid, 40% of the doctors in this country and 65% of the specialists won't see you. But we're going to say we're going to give you coverage in a system where you have access to only 60% of the doctors. That's not choice. That's relegating you to a system that says you can't get care. And I've talked on this floor about pediatric subspecialties. Because of Medicaid, We have an absolute dearth of pediatric subspecialties because the payment mechanism is so low that nobody will spend the extra time in residency to become a pediatric subspecialist, whether it's be a cardiologist or gastroenterologist or pediatric endocrinologist or pediatric neurologist. We can't find them. Nobody will go there because the rates for reimbursement are set so low. So they make physicians graduating from medical school make an economic decision based in the health of, and well-being of their family to not go into those areas because we have forced it. What we know is there are poorer health outcomes in Medicaid. That shouldn't be surprising because some of the best doctors aren't available to Medicaid patients because we won't pay for their expertise. We also pay an extra $1,800 per family, everybody in this country that has insurance, because of the underpayment of Medicare and Medicaid. Finally, with this large tranche of people under this bill that are going into the Medicaid program, we're going to break the states if they're not broken already. Yeah, we're going to cover it for 4 years. For certain states, we're going to do a whole lot better than that. Louisiana and a few others that we have made special exceptions for. But we're basically going to transfer a load of fiscal responsibility, call it equal, and put that load on the taxpayers of the individual states. So as we look at health care, one of the things I wanted to do was to talk about the problems, but also talk about the bill that we have up before us. And make this point. Are we better off with the government running health care? Or are we better off changing the system in such a way so that the patient is put first, the government's put last, and the doctor's 100% advocate for their patient? Which would be the better way? Knowing that we've got $700 to $800 billion a year wasted, why would we not design a system that goes after that waste and create the same opportunity for everybody in this country? So when you look at the Patient's Choice Act, which my colleague Senator Burr is going to talk about in a minute, there are some important things. First, let me tell you what the CBO says about it. The CBO says it will reduce future budget deficit relative protections under current law by amounts that increase over time. The first 10 years, $70 billion. But what it'll do for the states is $1 trillion in savings the first 10 years. It'll lead to lower budget deficits. That's what the CBO said. It said it also would reduce spending on health care because it'll be more efficient spending. And then finally, the federal contribution for Medicaid would grow at a lower rate, lower than healthcare inflation, which means it's going to save a ton of money for the states. The bill we have before us creates 70 new government programs. It has 1,697 times that we're going to write bureaucratic rules and regulations that are going to cause the government to step between the patient and their caregiver. 1,697 times. Its estimate right now is somewhere around 20,000 new federal employees. We're trying to get a handle on that. 20,000 new federal employees to tell you what you will and won't do in your health care. It's going to create at least $5 to $10 billion in new requirements for the Internal Revenue Service just to check on you. That's per year. To check on you to make sure you're filling out the forms right. It's going to create a massive disruption in the insurance market. Nobody that practices medicine today likes insurance companies. And the very fact that we would have our colleagues claim that we're defending the process is absurd. What we're defending is allowing the free market with legitimate regulation to allocate a scarce resource without putting the patient second. There's a big difference. I can tell you horror stories about insurance companies, but I can tell you worse stories about the federal government and the fact that it denies twice as many claims per 10,000 claims as all the other insurance companies. So when we're talking about access to care, both of the bureaucracies are a nightmare. And yet this bill creates the mother of all bureaucracies, the mother of all new programs. You know, I'll make one last point and yield to my colleague. We've been down here fixing things that are wrong. You know, we fixed the Preventative Services Task Force. We said it doesn't apply to breast cancer screening. That's what we said. We voted for it. It doesn't apply. Are we going to pass that every time? We didn't get rid of it. We didn't get rid of the Medicare Advisory Commission. We didn't get rid of the Cost Comparative Effectiveness Panel. Every time they make a bad decision, are we going to pass a law and say you were wrong? Or are we going to trust the professionals, the professional societies that guide my practice of medicine today? Or are we going to have a bureaucrat and a bureaucratic system that says what you will get and what you won't? Under the bill we have, you're going to have that. Now, we've taken the hot potato off the floor in terms of breast cancer, in terms of what they said. We said it doesn't apply. And we passed something for women's health, which I applaud. But what about men's health? What about children's? What about prostate screening for men? What about colon screening for men? What about cardiovascular screening for men? We said no, we didn't do a thing. And why didn't we? Because we know a larger percentage of the emotional attraction has to do with those things associated with women. So we pounded our chest and passed the Mikulski bill for preventative care for women, and we ignored the preventative requirements of everybody else in this country. Now, how's that fit with what we should be doing? It doesn't connect. It's political. It makes good news. It satisfies vocal interest groups. But does it really fix the long-term problem? I yield to my fellow